Good morning, and thank you for joining us on today's Shareholders Update regarding our latest news release this morning announcing the acquisition of Doctor Center in Jacksonville, Florida. My name is Prad Sekar, co-founder and CEO of Skylight Health. Earlier this morning, we announced our first acquisition post our uplist onto the NASDAQ this month. Our model at Skylight is to help fee-for-service primary care practices in the U.S. transition to a value-based care model driven by both an acquisition and de novo strategy. We are very excited to welcome the Doctor Center to the Skylight platform. Jacksonville and Northeast Florida represent important markets for us, both in terms of opportunities for growth, but also Florida is a fast-growing managed care market with a growing senior care population and health plans that support value-based care. Doctor Center is our second acquisition in the region following River City Medical in January of this year. Density in a key market like Florida is important for a few main reasons. Firstly, it presents us broad market exposure to remain competitive in both recruitment and retaining providers. Secondly, it helps us establish stronger payer relationships and contracts, improving the performance of practices pre-Skylight. And last but not least, it helps us scale more services for patients over time that create better opportunities for success and meeting quality metrics in value-based care plans. Florida is a market where we have already seen early versions of managed care contracts, and further expansion in this region is something we are very much focused on. This is in addition to our key markets we are in today. As we decided a few months ago, we are shifting away from announcing LOIs and only announcing closed transactions. Hence, we are ensuring proper diligence before each deal closes so we can look to see the best success post-closing. We have also refrained from disclosing deal terms on these transactions. We are evaluating and under diligence on a number of deals. This strategy allows us to remain more competitive and establish a stronger negotiation platform. However, all deal terms in the future will be reported in our financials. Doctor Center continues to remain on track with our previous acquisitions. It will be immediately accretive. Last year, unaudited revenues were approximately 3.2 million Canadian, and EBITDA margins were expected to be at approximately 10%. The transaction cost remains in line between 3 to 7 times EBITDA and a little under 1 times revenue as with previous transactions. We will look to add 6,000 new patient lives with a growing senior care population that will support managed care contracts with Medicare and Medicare Advantage plans. Dr. Hassan and his team will remain on with Skylight post-closing and will be a strong part of building the practice and growth in managed care. We expect to see more deals close as we continue to work through diligence, and along with these, news as we can update all of you on our progress internally, as well as in negotiating managed care contracts. So until then, thank you, and I look forward to updating you further on the next news issue. For any questions, you can always email us at investors@skylighthealthgroup.com or visit us on our website at skylighthealthgroup.com.